We're reforming the provision of frail, elderly and unscheduled care within Durham and Darlington. With the implementation of 7-day services, the landscape is set to look quite different. There are 4 key settings where we will see the changes. In acute hospital sites, in the homes of elderly people, in care homes and in GP surgeries. Let's take a look more closely. Arriving at the GP practice at 2 p.m. on Saturday, we note the practice is open and offering both emergency appointments and clinical sessions to patients who have booked their appointment through the multi-agency single point of access. A mixture of local point of testing, locality-based X-ray and digital healthcare systems provides a local, integrated, diagnostic support system. The GPs working on Saturday sessions are from a range of local practices. The local GP Federation provides a locality-based approach to 7-day working and medical cover. A frail elderly MDT meeting is in progress with a local GP with special interest, a social worker, a community matron, a community diabetic specialist nurse, and a CPN. They are holding a video conference with a community geriatrician linked in from the local community hospital. Together, they're working on assessments of patients, aiming to move back to home-based settings. The MDT are using a shared single care record as the basis of case management. This is for both high-risk patients and those who are being discharged from the hospital. The social and community staff link in through their mobile working laptop system. All patients on the MDT system have agreed to share their information. Leaving the practice, we note that a program of LTC support sessions are planned for Monday. Consultants and specialist nurses are booked to provide integrated support sessions to frail elderly patients with multiple conditions: diabetes, vascular and supporting podiatry and retinal screening sessions being carefully planned to allow access until 7 p.m. Travelling to a local care home on Sunday, we note a community matron is undertaking a review of 6 patients. 3 identified in a local MDT meeting from risk stratification process as having a risk of escalation, and 3 recent arrivals from a planned discharge process, 2 from a community hospital and 1 from an acute. The patient discharged from hospital arrived an hour ago. The community-led integrated intermediate care team planned the discharge from the hospital. Essential medication has been provided from the new 7-day pharmacy service. The patient's hospital discharge information pack included a web-generated nutrition plan and a digital health monitoring pack. This cheap and flexible digital health pack, brought by the ISIS HCA in the boot of her car, was connected and put online and started taking readings within 10 minutes. The information, being cloud-based, allows decisions around additional care to be made by local GPs assessing clinical information. The INR-dependent patient is also using the digital monitoring system to dose check as required. The care home staff are preparing for a visit from a local care home support team, made up of a GP, community matron, and pharmacist, who provide focused support to help avoid hospital admissions. In a local elderly person's home, an advanced nurse practitioner is visiting to check out a person on the local risk of admission register. The person's carer has called for help from the SPA as they were concerned. The ANP is using a digital stethoscope to listen and transmit in real time the heart and lung function to a COPD consultant operating in the front of house team of the local A&E unit. The conclusion is that a course of IV antibiotics supported by the local nursing team in the person's home and an enhanced support package, which includes third sector sitting service, organised by the social worker through the SPA, will prevent risk of admission. The carer has on their carer patient portal a contact name and support person named to discuss their concerns if required. At the local acute hospital site, we note the car park is not full and is free. A headline on a newspaper in reception reads, "Concerns as community health system is close to being full and hospitals will need to pick up additional patients." The redesigned A&E area, with facilities designed from benchmarking best practice, is now part of a community system. It is an integrated system with clear and distinct triaging for children and adults, with rapid access to consultant decision makers 24/7. This access is extended to GP and to community hospitals via digital consulting links. There are no emergency ambulances at the door, although a local floating GP who moves around the locality on a 7-day rota system and is in the A&E unit notes she has this morning worked with paramedics in a see and treat approach to prevent 3 admissions. The redesigned A&E unit has also had effective 7-day staffing put in place to match projected demand. In the diagnostics area, it is noted that the MRI schedule includes non-urgent scans. Slots for community geriatric patients referred by the MDT to prevent admissions are prioritised over routine inpatient scans. Clinics and ward rounds on the specialty service areas run on a 7-day basis. The Trust has reviewed and realigned its delivery across its 2 main sites to ensure it has clinical cover by only delivering some services on one site, delivering key services on both sites 8 a.m. to 8 p.m, with one site being 24/7, and realigning support services. In a range of interviews, talking to key individuals, we note
we really benefited from redesigning our delivery approaches in frail, elderly and unscheduled care in 2014. We now have a locality-focused approach with dedicated and aligned community matrons, nurses, primary care teams, social care and mental health teams wrapped around clusters of GP practices.
Dedicated MDT core members for frail elderly included community geriatricians. Where these were in short supply, GP with special interest aligned GP provider federated teams. This allows primary care the flexibility to offer 7-day cover to patients, allowing access to effective and fast diagnostics.
This locality system provided the focus to develop integrated teams of health and social care staff, centrally housed but mobile-enabled, an information sharing system and culture that enabled a true patient-focused case MGT.
this is our vision for 7-day frail, elderly and unscheduled care services within County Durham and Darlington.